My name's Dr. Haroon Gajraj. I'm a vein specialist, trained as a vascular surgeon in London and did most of my surgical training in London. I took up an appointment in Somerset as an NHS consultant 17 years ago now, and treated the whole range of vascular problems, arteries, veins and other problems. But about 5 years ago I left the NHS to concentrate exclusively on the treatment of veins, and that's all I've been doing now for 5 years. So I've given up all my arterial work and I just deal with vein problems. Well, what are varicose veins? Well, you don't need to be medically trained, you don't need to be a doctor to look at your leg or somebody else's leg and know that there's something wrong with the veins. So, for example, this person has a cluster of spider veins at the back of the leg with varicose lumpy veins to the side. And medically, they are abnormally large. They're wider and bigger than they should be. They're obviously twisty and turny. And they have a condition in them called reflux. Veins should be carrying blood up the leg, back from the foot to the heart. If the little folds in the lining are not meeting properly and gravity is pulling blood down in the wrong direction, then we give this the term vein reflux. And the underlying problem with these thread veins and these spider veins is that the direction of flow is wrong, the valves are not working properly, and blood is coming down in the wrong direction. That's the medical underlying problem. What causes varicose veins? Well, top of the list is heredity. Unfortunately, you can pick your friends, but you can't pick your parents. And most cases of vein problems are inherited or have a genetic basis. It's been estimated that if both your parents have a vein problem, then you, unfortunately, have an 80% chance of developing a vein problem yourself. It's not inevitable, but it's a high risk if you have a strong family history. Other things on this list don't actually cause varicose veins, but they contribute. So if you've inherited a weakness of your veins and you have an underlying problem, often veins will appear for the first time during pregnancy because of the added strain on the vein circulation. It doesn't actually cause it, but it's another risk factor which declares itself if you have an underlying problem. And all these other things contribute. Having said that, we know lots of people, don't we, who have had lots of children, who are possibly overweight and don't have a particularly healthy lifestyle, not a blemish on their legs. Doesn't seem fair, does it really? But equally, there are many young men who are quite athletic and very fit. Obviously, they've never had any children themselves, and they've got dreadful varicose veins. So it does appear that heredity is the main risk factor. What causes thread veins? Well, I've already mentioned that reflux is the underlying problem. So it's not a surprise, really, is it, that top of the list is heredity. Again, many people have not a blemish on their leg because they've inherited good veins from their parents. Others, unfortunately, haven't had any children, not overweight, very healthy, and they've covered in spider veins and thread veins. The underlying problem is a weakness of the veins, and it's a problem called reflux. So heredity tops the list. All these others are contributing or risk factors. They don't actually cause them. However, I would say that reflux, which also causes varicose veins are often associated with thread veins. In fact, when I see people with thread veins, one of the important things is that you check very carefully for underlying reflux so that the problem is treated correctly. Are they simply cosmetic? Well, a question I get asked a lot is, I've been to my doctor with my veins and he tells me that the treatment's not available on the NHS. and often that person is told that they're simply cosmetic. Well, they're not simply cosmetic. As you can see from this slide, a healthy vein is nice and straight, and it's got strong folds, strong valves in the lining that meet properly, keeping blood directed upwards from the leg back to the heart. On the right, we have a varicose vein. It's wider than it should be. It's tortuous, it's wiggly, and the valves, these little folds, are weak and floppy, and they're allowing blood down in the wrong direction. So varicose veins are unhealthy veins with faulty valves and this condition called reflux. So it's not simply a cosmetic issue. As you can see in this slide, we've got a leg where we've got a superficial vein, that's a vein underneath the skin, that is refluxing and faulty, and the blood is coming down in the wrong direction from the top of the thigh down into these lumpy varicose veins and further down into these little spidery veins. So the underlying problem is reflux. It's not simply a cosmetic issue. It's a shorthand way of saying the majority of people don't get major problems, but to dismiss them as simply being cosmetic is not correct. This is a lady I saw a few years ago, and she too was denied NHS treatment initially. She had quite bad reflux in the veins in her thigh, feeding into varicose veins in her calf, which were causing quite a lot of swelling of her leg, and they were causing quite a lot of thread veins and spidery veins around the ankle, and also after a little while were causing a condition called varicose eczema, which I'll come on to in a moment. In her case, they weren't simply cosmetic. She actually had to argue her case quite strongly, and at that time had to appeal to the Primary Care Trust, the PCT. Eventually she was granted NHS treatment, but her operation was cancelled 3 times. Twice on the day of her operation. She'd been all prepared and got ready, and in frustration she decided that she would have her veins treated privately, and she was concerned, quite rightly, about the possibility of ulcers. So what problems can arise? One of the questions I get asked again quite a lot is, I've got bad varicose veins, will I get a leg ulcer? I'm worried about leg ulcers. Well, in fact, the majority of people with even quite severe varicose veins do not come to any harm. And I think this is the main reason why the NHS doesn't treat veins. They do, however, cause a lot of ache, a lot of itch, swelling. These symptoms do tend to be worse in hot weather. They tend to be worse at the end of the day. And they're also very unsightly. I think it's sometimes difficult for us men to understand how much distress they cause to women particularly, and increasingly men. It interferes with what you can wear, what sort of holidays you can take, what sort of social activities you might be involved in. I came across a lady not so long ago who wouldn't take her children swimming because she felt so embarrassed about the sight of her legs, and the distress that some of these unsightly veins cause can be quite severe. I say even thread veins. We now know that thread veins and spidery veins are associated with this condition called reflux, so it's not surprising that even thread veins cause symptoms or are associated with symptoms. Until we knew a little bit more about the condition, we didn't really, as doctors, believe people who say, well, my thread veins hurt and they burn and they itch, but they do. And we now know that if you treat thread veins properly, the majority of people get relief of their symptoms as well. So, as I say, frequent question is, I've got bad varicose veins, will I get a problem? Well, the majority don't. But if you do get medical problems, they come under one of these 4 headings. As I say, the majority will not. The first one I'd like to talk about is phlebitis. A frequent question is, I've got phlebitis, what is it, and will it cause me any harm? Another condition is varicose eczema, a condition of the skin caused by reflux, and these other conditions, deep vein thrombosis, bleeding, and ulcers. And let's talk about those very briefly in turn. Now, phlebitis is often a misused term both by the public and by doctors. The strict medical definition of phlebitis is an inflammation in the vein. That's all it means, really. Doctors add the word itis on the end of the word to indicate inflammation. I think phleb is a Greek or Latin word that means vein, and itis means inflammation. So it's an inflammation of the vein. It appears clinically, that is on the surface, as a hard, tender lump underneath the skin. So it's quite superficial. Phlebitis involves the superficial veins. It's superficial and it has all the features of inflammation. So if you've ever had inflammation elsewhere, you'll know that it's red, warm, tender, and it's quite a severe condition. These people often can't go to work. It's that painful. And it used to be thought to be quite a trivial condition. So if you went to see your doctor, he'd say, oh, that's just a bit of phlebitis. Take some painkillers and go away. We now know, however, that to diagnose phlebitis correctly, you should have an ultrasound scan. People who are diagnosed as having phlebitis are often misdiagnosed. And when you look with an ultrasound scan, there's another condition. So having an ultrasound, firstly, confirms that it is phlebitis because you can actually look at the superficial vein and the appearance on ultrasound is quite characteristic of the condition. And you can make sure there's nothing else amiss because we now know that phlebitis is frequently associated with deep vein thrombosis. The clot that occurs inside these veins can extend further and into the deep veins, and that can be quite a significant problem, quite a severe condition. Last week I saw a patient in Bristol who had been treated by his doctor with phlebitis, and in fact he had a deep vein thrombosis all along. So the diagnosis was wrong. It would have been established with an ultrasound scan, and he had quite a significant deep vein thrombosis that put him at risk. So phlebitis is not a trivial condition. It should now have an ultrasound scan. That's the recommendation of 2 very influential bodies, one in the United Kingdom and one in America. And that recommendation came out last year, that all people with phlebitis should have an ultrasound scan. I don't know if anyone here in the audience has had phlebitis and whether they had an ultrasound scan, but I think now if you have been told or you suspect you've got phlebitis, you should have an ultrasound scan. Varicose eczema. This is a condition that affects the skin, usually just above the ankle. Now this is a term that is misleading. You might think, well, varicose eczema, it's a skin problem. And indeed, I see many people who are treated with creams, often steroid creams. These conditions are very itchy. They can drive you mad, and they can keep you awake and cause a lot of distress. And there's no doubt that there is inflammation of the skin, and there's no doubt that if you put steroid cream on, you will feel better. The itching will go, your leg will feel better, and it'll give you some relief. But, I beg your pardon. Varicose eczema is not principally a skin condition. It's due to this problem called reflux. And what this indicates is that the skin is being damaged by this faulty vein circulation. It looks like eczema, but it actually indicates that there's damage to the skin and that that skin is vulnerable and at risk of ulceration. So this condition is often the precursor of a leg ulcer. Not tomorrow, not the day after, it takes time, but the skin is vulnerable and at risk, and this should be treated to prevent an ulcer. It's not a skin condition. It shouldn't really be treated with steroids. In fact, steroids, if you put them on long term, they actually thin the skin and they make the skin more vulnerable, more liable to ulceration. So varicose eczema should be treated by a vein specialist or a vascular surgeon, not a dermatologist, not with skin creams. Deep vein thrombosis, well, this is the fear of most people. In fact, it's not very common as a complication of veins. It's only recently that we are confident now to be able to say that varicose veins are a risk factor for deep vein thrombosis. There's now good evidence in the medical literature to support that. It doesn't mean you're going to get one inevitably, but if you have an additional risk factor, varicose veins will contribute. So for example, if you were to go into hospital and have major surgery, say a hip replacement or a major operation for bowel cancer, and you had bad varicose veins, it would slightly increase your risk of a deep vein thrombosis. If you were to go on a long-haul flight with bad varicose veins, it would add to your risk. It doesn't cause it, but it is a risk factor. And anyone under those circumstances, coming out of hospital after surgery, stepping off a plane after a long-haul flight, who has one leg more swollen than the other, it should ring alarm bells. Have I got a deep vein thrombosis? And again, the only way to diagnose a deep vein thrombosis accurately, or to exclude it, to say no, you don't have a deep vein thrombosis, is to get an ultrasound scan. Now the next slide is a little bit scary. I'm sorry, I keep meaning after these presentations to take it out and put a less scary slide in. It is a little bit scary. If you're squeamish, look away. Having said that, most people wake up at this stage and it's the slide they all want to see. This is a leg ulcer. This is the dreaded complication of varicose veins and reflux. Once they develop, this is quite a severe one, once they develop, they're very difficult to heal, they're very difficult to eradicate. Even when you do get them healed, they heal with a lot of scar tissue. The area is quite vulnerable and it's never quite normal, so it's always a little bit more vulnerable to knocks and injuries. So leg ulcers, once they're established, do tend to recur, even with the best available treatment, because of the vulnerability and of the scar tissue. So avoid leg ulcers if you can. I'm sure nobody wants a leg ulcer, but if you've got varicose eczema and you've got any complications from your veins, we know that early treatment will give better results and will reduce the risks of complications. So as I've mentioned, many people go and see their doctor, they say I've got vein problems, but the NHS doesn't treat them. Why is this? Well, the NHS doesn't see veins as a priority, and the majority of people, even with quite severe vein problems, don't get a major complication. The NHS is strapped for money. I think we have to accept that, and there are other more pressing requirements. There's no national target for veins, there's no 2-week wait for veins, and there's no targets, as there are, as you'd expect, for an ambulance arriving. We all expect, if we're injured, that an ambulance will arrive within a certain time. We all expect that it will take us to a well-equipped hospital with an operating theatre if we need urgent surgery. And we all expect that if we suffer a heart attack, we're taken to coronary care and we're looked after. This all costs money, and obviously the NHS has limited resources. I don't want to get too political, but you can imagine that if the majority of people don't get a major problem from their veins, the NHS can't treat everybody. It has to ration treatment. The National Institute for Care and Health Excellence, NICE, last year, 2012, or no, 2013, earlier this year, only in the summer of this year, made several recommendations about the treatment of veins. And it said specifically that anyone who's got symptoms from their veins should be referred to a vascular surgeon. However, we know, and I know, that currently people, even with varicose eczema, are finding it difficult to get NHS treatment. So although NICE believes that people should have advice, the reality here in this area is that people are finding it difficult to get access to treatment. Other reasons. Thread veins are often regarded as cosmetic, when we now know that the majority of people, even with thread veins, have reflux. Varicose veins are not a priority, as I've mentioned. There are other more pressing problems for the limited resources of the NHS. I was going to say it's rationed by strict criteria. They seem to be getting stricter and stricter, and access seems to be getting poorer and poorer as time goes by. And I see people who have had bad phlebitis or who've had varicose eczema who can't get treatment. Very difficult. And obviously, your doctor needs to keep up to date with all sorts of new developments in diabetes and blood pressure and childcare and dementia. He finds it very difficult to keep up to date with all the latest treatments on veins. Not surprisingly, your GP may not be able to refer you to the local hospital for veins. So at the end of a busy surgery, he's hardly going to spend hours reading on the latest developments on veins.